Well, one of the things about diabetes that you might want to hear is some of the latest research, because in the past there was pretty much a clear understanding that the solution to diabetes was simple weight loss. So in other words, if you lost weight on your own, you could expect your diabetes would get better. And what we found is that's not always the case. There are some thin people. And then the other thing was that since that research is pretty clear that weight loss helps diabetes, that when you get weight loss from our surgery, it was simple that that was the cause of diabetes getting better. And so beginning a couple of years ago, about 10 years ago now, some French researchers asked this question. If you lost weight on your own and you lost weight with a gastric bypass, were you getting the same amount of effect on diabetes and the hormones in your body that cause diabetes? So in other words, when you do a gastric bypass, is it just the weight loss or is there something else? And for many years, we just said, it's just the weight loss. If you could lose weight on the own, it would be exactly the same. We now know that's not true. This is very exciting and very interesting research, especially for those of you who are diabetic. And here's what they did. First of all, they took mice and they divided them into two groups, and they gave one group a gastric bypass.
That'd be hard.
So hats off to them. But doing a mouse gastric bypass, first it's hard to get the permit. So they did a gastric bypass on a group of mice. Then they measured how much weight they lost every day, and they cut back the food in the control group so that they lost exactly the same amount of weight as the mice who had the gastric bypass. They were a couple weeks behind them, but they said, okay, you're at this weight, we'll cut the food back, and so that the weight loss in the two groups were exactly the same. Now, the mice that they had selected were mice that developed diabetes. And then they measured the impact of these two treatments, just weight loss alone or weight loss with the gastric bypass, and they found that the resolution of diabetes was much, much, much improved with the gastric bypass over weight loss alone. Then the next piece of research that came out was a study from the Mayo Clinic where they found in their entire experience of thousands of gastric bypass patients who they did plus were referred in from around the world, they found 3 people that had a disease that had never been seen before in adults. And the name of that disease was nasidioblastosis. Nasidioblastosis is a big word for your insulin cells in your pancreas grow a lot. So they had 3 gastric bypass patients who developed this rare disease. It's rare in children, and it's never been seen in adults, except in these 3 gastric bypass patients, and they hypothesized that the gastric bypass causes a stimulation in the beta cells in the pancreas that release insulin, and that in these cases it went overboard. Then they did another study, and they looked at some other pro-insulin hormones in diabetics who had gastric bypass. And they found 2 hormones that help in controlling blood sugar in the body. One is glucagon-like peptide, or GLP, and the other one's gastrointestinal peptide, or GIP. And they found both GLP and GIP were increased after gastric bypass. So the new latest research suggests that the gastric bypass itself does more than just cause weight loss. It actually changes the pancreas, stimulates the pancreatic islet cells, and improves GLP and GIP, which are pro-insulinogenic hormones. And we may now be on the threshold of being able to say that in some patients, gastric bypass may actually cure diabetes.
That's good.
So pretty exciting research. We're very excited about it to think about that. And so we would like to follow up on your sugars. We may want to actually get an insulin level and other things like that. So stay in touch as we go through this.
Sure.
Our expectations are that we have an excellent chance, depending on when we test our patients, of between 85 and 98% of our diabetics get their diabetes resolved.
I'm hoping.
Yeah. So, but we do need to pay a little bit more attention in your case, because when you came to us, it looks like you had a little more baggage with your insulin.
Oh, yes.
Good.